Hi everyone, welcome back to our channel. Today we will discuss about the most important topic for the exam point of view in psychiatric nursing. Obsessive Compulsive Disorder, OCD, short form. First question, the hallmark features of the OCD, Obsessive Compulsive Disorder, is option A, hallucination, option B, recurrent obsessions and the compulsions, option C, mood swing, option D, memory loss. The answer is option B, recurrent obsession and compulsions, because OCD is characterized by the persistent intrusive thoughts, means obsessions, and the repetitive behaviors, also known as the compulsions. So the answer will be option B, recurrent obsession and the compulsion. Next, an example of an obsession is option A, repeated hand washing, option B, persistent fear of the contamination, option C, checking locks once, option D, forgetting the appointments. Option A is the correct, option B is the correct answer. Persistent fear of the contamination, because obsession are unwanted. Intrusive thoughts are fears causing the anxiety. So the answer will be option B. Next, an example of a compulsion is option A, repeatedly washing hands, option B, fear of spiders, option C, feeling sad, option D, forgetting keys. The answer is option A, repeatedly washing hands, because compulsion are the repetitive behaviors performed to relieve the anxiety from the obsession. So the patient will wash the hands more than 6 times, 7 times, 8 times, 9 times, or so many times they will do the hand washing for their relief the germs. They thought in their hands so many germs are there, that's why they are doing continuously hand washing. Next, the most common age of onset for the OCD is option A, childhood or the adolescence, option B, late adulthood, option C, middle age, option D, after the 60 years. The answer will be option A, childhood or the adolescence, because OCD typically begins in the late childhood or the early adolescence, and although adult onset is the possible. So the answer will be option A. Next, which neurotransmitter is the most implicated in the OCD? Option A, dopamine, option B, serotonin, option C, acetylcholine, option D, GABA. The answer is option B, serotonin, because serotonin dysregulation in the corticosteroid thalamocortical citrus and contributes to the OCD symptoms. So the answer will be option B. Next, a nurse observes a patient repeatedly checking if the door is locked. This is example of option A, obsession, option B, compulsion, option C, delusion, option D, hallucination. The answer is option B, compulsion, because repetitive behaviors reduce the anxiety. We already discussed in before only. So the answer will be option B, compulsion. Next, which statement is true regarding insight in the OCD? Option A, patient always recognize their thoughts are the irritational. Option B, patients never recognize their thoughts are the irritational. Option C, insight varies. Some patients realize thoughts are unreasonable. Option D, inside is not assessed in the OCD. The answer is option C. Inside varies, some patients realize thoughts are the unreasonable. In OCD, patients may have the good, poor or absent insight into their behavior. Next, a patient spends 3 to 4 hours daily washing their hands due to contamination fear. The level of impairment is considered as a option A mild, option B moderate, option C severe, option D none. The answer is option C, because severe. OCD causing the significant disruption of the daily life. When it will affect the daily life activity severely, it is known as the severe. It is classified as a severe symptom. So the answer will be option C. Next, first line pharmacological treatment for the OCD is option A SSRIs, selective serotonin reuptake inhibitors, option B benzodiazepines, option C typical antipsychotics, option D beta blockers. The answer is option A selective serotonin reuptake inhibitors, because they are effective in reducing the obsession and the compulsion. Next, cognitive behavioral therapy effective for the OCD includes option A exposure and the responses the prevention, option B psychoanalysis, option C hypnosis, option D electroconvulsive therapy. The answer is option A exposure and the response prevention, because ERP helps patients face anxiety provoking stimuli without performing the compulsion. So the answer will be option A. Next, which is a common comorbid condition with the OCD? Option A schizophrenia, option B depression and the anxiety disorder, option C diabetes mellitus, option D hypertension. The answer is option B depression and the anxiety disorders, because OCD frequently coexist with the depression, generalized anxiety or the social anxiety. So the answer will be option B. Next, a patient repeatedly arranges items symmetrically. This compulsion is classified as the option A checking, option B ordering or arranging, option C hoarding, option D counting. The answer is option B ordering or arranging, because ordering or arranging compulsion are aimed to reducing the anxiety caused by the perceived disorder. So the answer is option B. Next, hoarding behavior in OCD is option A not related to the OCD, option B a subtype of OCD, option C always caused by the depression, option D a normal habit. The answer is option B a subtype of the OCD. Hoarding disorder is considered a separate but related condition within the OCD spectrum. So the answer is option B. Next, which statement is correct about the obsession in the OCD? Option A, they are voluntary thoughts. Option B, they are intrusive, unwanted and cause distress. Option C, they improve with the relaxation. Option D, they are only seen in the children. The answer is option B. They are intrusive, unwanted, and the cause distress. Next, which physical symptoms may occur during the compulsion? Option A, fatigue. Option B, hyperactivity. Option C, fever. Option D, hypertension. The answer is option A, fatigue, because excessive time spent performing compulsion can cause the fatigue and the also distress. Next, a patient repeatedly checks the stove to prevent fire. This compulsion is primarily motivated by habit. Option B, desire to reduce the anxiety from obsession. Option C, pleasure. Option D, delusion. The answer is option B, desire to reduce the anxiety from the obsession. Option B is the correct answer, because compulsions are the ritualized behaviors aimed at the elevating obsession related to the anxiety. Next, a common cognitive distortion in OCD is option A, catastrophizing. Option B, normal reasoning. Option C, abstract thinking. Option D, inside the preservation. The answer is option A, because patients often overestimate risks and the consequence of their intrusive thoughts. So the answer will be option A. Next, which nursing intervention is appropriate for a patient with the OCD? Option A, encouraging gradually exposure to the feared stimuli. Option B, performing rituals for the patient. Option C, ignoring compulsion. Option D, restricting all activities. The answer is option A, encouraging gradually exposure to fear the stimuli, because exposure with the responses. Prevention is the therapeutic while supporting patient autonomy. Next, which is a red flag for the suicidal risk in OCD? Option A, mild contamination fear. Option B, severe distress and the comorbid depression. Option C, checking rituals once daily. Option D, hardening without stress. The answer is option B, severe distress and comorbid depression. Option B is the correct answer. Next, behavioral therapy for OCD aims to option A, eliminate obsession immediately. Option B, teach patients to resist compulsion gradually. Option C, replace the medications. Option D, encourage avoidance. The answer is option B, teach patients to resist compulsions gradually. Next, which diagnostic criteria are required for the OCD? Option A, obsession, compulsion, and the significant functional impairment. Option B, only the obsession. Option C, only compulsions. Option D, hallucinations and delusions. The answer is option A, obsession, compulsions, and the significant functional impairment, because diagnosis requires presence of obsessions, compulsions causing the distress or the interference. Next, which factor can worsen OCD symptoms? Option A, stress. Option B, adequate sleep. Option C, medication. adherence, option D, relaxation. The answer is option A, stress. Option A is the correct answer because stress often exacerbates OCD symptoms, increasing the frequency or the intensity of the obsessions and the compulsions. Next, a patient repeats the prayers 50 times daily. The nurse should identify this is an option A, compulsion, option B, obsession, option C, depression, option D, normal religious practice. The answer is option A, compulsion, because ritualistic repetitive behavior performed to reduce the anxiety is known as a compulsion. Next, family involvement in OCD care is important because families can participate in the ERP support. Option B, OCD does not affect family. Option C, family increase patient distress. Option D, family involvement is the discouraged. The answer is option A. Families can participate in the ERP support because family support improves the adherence and outcome the behavioral therapy. Next, which assessment tool is commonly used to measure the severity? Option A, Yale Brown Obsessive Compulsive Scale. Option B, MMSE Mini Mental Status Examination. Option C, PHQ. Option D, GAD 7. The answer is Yale Brown Obsessive Compulsive Scale. Option A is the correct answer. Option A is the correct answer because its severity of obsession and the compulsives. Next, SSRI effective in OCD includes option A, fluoxetine, option sertraline, fluvoxamine, option B, haloperidol only, option C, diazepam only, option D, lithium only. The answer is option A because early intervention, option A, because early intervention in the SSRIs are the first line pharmacological agents for the OCD treatment. Next, which statement about the OCD prognosis is correct? Option A, with treatment symptoms may be significantly improved. Option B, OCD always resolves without treatment. Option C, prognosis is poor regardless of therapy. Option D, medication is ineffective. The answer is option A. With treatment, symptoms may significantly improve because early intervention with the CBT and SSRIs improves the functioning and the symptoms control. Next, which is an appropriate nursing priority during acute OCD exacerbations? Option A, ensure safety and reduce the distress. Option B, ignore compulsions completely. Option C, encourage isolation. Option D, avoid medication administration. The answer is option A, ensure safety and reduce distress because nursing care focuses on safety, emotional support and the collaboration with the treatment plan. So the answer will be option A. Next, a patient demonstrates inside that rituals are excessive but cannot resist. This is called as option A, good inside OCD, option B, poor inside OCD, option C, delusional disorder, option D, schizophrenia. The answer is option A. Good inside OCD. Good inside OCD refers to recognition of irritationally while struggling to resist the behavior. Next, which lifestyle modification supports the OCD management? Option A, stress management. Option A, stress management, regular sleep and the structured routines. Option B, avoiding therapy. Option C, increase the isolation. Option D, skipping the medication. The answer is option A, stress management, regular sleep and the structured routine. Because healthy routines and the stress reduction enhance the treatment response and the reduce symptoms severity. Thank you everyone. Please like, share and subscribe our channel.